Welcome back. Our next guest always put her family first, but now that Rhonda Clay's kids are grown, she decided it's time to do something for herself. That something started with a new smile that makes her look and feel 20 years younger. Please welcome Dr. Terri Alani to tell us how modern-day technology makes veneers much more convenient, and her patient Rhonda, who just can't stop smiling. Look at you. Times that's what we do. We kind of put ourselves on the back burner there, and so doing something like this, you thought, okay, I'll get to it one day, but so many things come before that.
Absolutely.
All right. And Dr. Alani, you know, sometimes there's an advantage to waiting. Technology has changed.
Oh, it's changed a lot. Nowadays, we don't really have to do a lot of preparation. The materials are much better. The porcelain lasts longer. It's more lifelike. So, and it's an easier experience.
Yeah. All right. So, Rhonda, you're smiling for two reasons. One, because you love your new teeth. The other, of course, is because you're the mother of four and they're all grown now and out of the house.
Yes.
Yeah. All right, there you go. Okay. Tell me how you used to feel about your teeth. What was the issue about your teeth?
My teeth were dark and they were crooked. I just didn't feel comfortable with them at all.
Yeah.
I didn't feel they were attractive. Pretty.
Yeah. And you didn't like smiling?
Not at all.
And Dr. Alani, you see this a lot where people, and we underestimate the power of a smile, that when you walk into a room, even for a job interview, whatever, you could literally not get that job because people are making perceptions about you.
Totally. I always say a beautiful smile speaks when you don't. And Rhonda was interesting because she came in, she heard about from the show, she knew what she wanted. We started that day.
Well,
I mean, she was like on it.
Yeah, because you have gone into several different things. You know, the other thing that you talked about before was snap-on smile, which is a phenomenal thing that you can just snap on and correct your smile almost right away. So you originally thought you might want that, right?
That is what I come in for, yes.
But she wasn't really a good candidate for it. And so we discussed her options. We showed her a lot of pictures and what have you, and then she elected to go ahead. It turned out gorgeous to do her veneers.
Yeah, and that
crowns,
speaks to going to somebody who's experienced in all of those things, that you're able to tell her what is best for her. All right, so look at her. She's just like... Let's go through, as you mentioned, that it's so much easier today in most cases. Before, I know there was the grinding down of the teeth. Oh, that's a major difference.
Before and afters there.
Wow.
I mean, it's pretty phenomenal.
Yeah,
yes.
yeah. So before, a lot of people would put things off because it was the grinding down of the teeth of the whole bit and going back for several visits.
Yes.
So these are ultra-thin shells that we basically kind of...
They're almost like a contact lens.
Okay.
So they're no longer that thick porcelain. And also, when we replace crowns, they're all porcelain, so they're actually metal-free. So you no longer get that black line.
Yeah. And talk about the point of convenience. They're so white and pretty right now. They don't stain, right?
No, porcelain does not stain. Now, the only thing that you can drink your red wine, whatever you want, except smoking is the only thing that can be really detrimental to your teeth in general.
And to several other things.
Exactly.
Right? All right, take us through the process. Obviously, we come in to see if we're even a candidate.
Exactly.
And who would be and who wouldn't be.
Right, and so, of course, we do the x-rays, we evaluate you, and a lot of times we will direct the patient to do Invisalign or orthodontics if we feel like that's the best option. Sometimes it's a combination of veneers and Invisalign, and basically it's just minimal preparation. So we'll take before and after pictures. It's 2 visits, fairly easy. The first appointment's a couple of hours. Sometimes we don't even need to numb the patient.
Yeah.
And then we send the patient off, and then 2 to 3 weeks later,
you're smiling pretty like that?
They get
All
their smile.
There are a lot of people out there who may do certain things, just like we talked about in the previous segment, but do they do them right? And you say there are questions you need to ask. One is, can I see your previous work?
Exactly. When you're going to a cosmetic dentist, you want to make sure that you see their work, because if you see pictures and they look like one size fits all and they're not natural looking, then you need to walk out and go get a second opinion.
Do you know gingival symmetry?
Gingival symmetry is really important. It can really alter the case. In this picture right here, you can see, if you look at the screen, all we did was take a laser and adjust the gingival contour, lengthen it on one of the front teeth.
Okay.
And it just can make a huge difference.
Yeah. Hidden cost?
Hidden cost, you want to make sure you ask your dentist that there are no hidden costs, so you're prepared.
Yeah, this is the cost right here, all right? What about my previous dental issues?
Okay, if you have any sensitivity, if you have any other cosmetic issues, if you're grinding, a lot of these can affect the outcome of the veneer, so you want to make sure that you discuss this with your dentist first.
Yeah. How close is the lab?
Okay, I feel like there's a lot of people that use labs that are out of state. Our lab is right down the street. It allows immediate tweaking if we need to have. It's more personalized. Make sure that the lab, ask your dentist how long have they been using the lab, and is the lab really good with cosmetic dentistry.
Okay, well, I need temporaries.
Exactly. So nowadays, we don't really have to use temporaries because it's minimal preparation. If you can see in the photos, basically on the left is the original teeth, on the right is the prep teeth. We don't really reduce that much anymore. So a lot of times you don't even have to have anesthesia.
And of course, and you touched on this earlier, what's the turnaround time?
Turnaround time is usually 2 to 3 weeks, depending.
Yeah, so ask those questions.
Ask those questions beforehand, yes.
All right. Well, Dr.